put on the computer. Good afternoon, everybody. It is 2 p.m. It is Friday afternoon, and it's Fertility Talk. And today we are talking to Dr. Paul Roux. He is a fertility specialist at Cape Fertility Clinic in Cape Town. So all of you that are at Cape Fertility Clinic, this is your, who are in Cape Town, this is your chance to actually ask Dr. Roux some questions and hopefully go and see him if you are dealing with infertility. So thank you very much for joining us, Dr. Roux. It's really a pleasure to have always a pleasure to have any fertility specialist. Take the time out to come and speak to us, and you're just to be able to listen to you and give us advice. It's invaluable, or how do I say? You can't put value to it. So thank you very much for that. And I'd just like to hand over to you, and you can give us a couple of, just tell us a bit more about what it is that you do at Cape Fertility Clinic.
Sure. Well, thank you so much, Leanne. I really appreciate the invitation to come and talk. And, I hope the information is useful for patients out there or people who are struggling with infertility. And I appreciate you listening in on a Friday afternoon. So it's great. And today we're going to talk about male infertility. And it's a particularly important topic because sometimes it's neglected a little bit. People tend to think of infertility as only affecting women, but obviously there are two partners very often that are involved in fertility treatment, and quite often infertility affects the male partner. But essentially, the treatment will involve the whole couple at the end of the day, and we need to isolate what the problems are and then deal effectively with the treatment. So I think there are two elements. One is that we need to investigate the male partner properly, and I'll go through just now, how we do that. But we also want the men to feel included in our clinic because they're just as important in terms of the process. And we try to make them feel as comfortable as possible because some of the men are quite scared to come to the clinic or feel intimidated. But I think modern fertility clinic, generally it's quite patient friendly and a comfortable environment, and you can certainly ask the doctors, whatever you'd like to know and get the information that's needed. So yeah, it's great to share everything with you. And thanks to Leanne from Fertility Solutions, which is, raising awareness via social media, which is very helpful. A lot of people can these days sit in their living room and watch one of these webinars. And also helping some of the patients with financing as well. There are some options because fertility treatment is sometimes quite expensive.
Yeah.
So thanks very much on your side as well. And so I'm going to talk, it'll be an informal talk. So Leanne can interrupt me with questions as we're going along. And if you post questions, then, we'll stop in between and answer the questions. So I'm going to put a couple of slides on just to show you some things. But we'll talk informally as well. Are you happy with that, Leanne?
I'm very happy. I just wanted to, you did mention it now, but I'd just like to say, please, if you have any questions, please put it in the comment section. I'm keeping an eye on this side to make sure that if there's any questions, because it always comes through afterwards, ladies. Just put it in the comment section and we'll be able to answer the questions in between. So please go ahead, Doctor.
Okay, so the place I work is Cape Fertility, which is a private IVF unit in Claremont. It's one of the biggest clinics in the country, and we can do all aspects of fertility treatment, whether it's just testing or actually proceeding with treatment. Some of the treatments people have heard about is intrauterine insemination or IVF treatment, but there are many specific treatments for male infertility as well. And I'll go through maybe some of the causes why people may have a problem, a male partner might have a problem to conceive, and we'll talk about, how we do the treatment as well. So this is where I work, and there's a whole big team of people that work with me. I try and get all the clever people to work with me, and I bask in the glory of all their achievements. So, it's important to have a good team, and in a fertility treatment is particularly important because we need a sophisticated laboratory. We need IVF nurses. We need administrative staff and doctors. So it's a big team that must all work together. Sorry. So just to start with, infertility is defined as the inability to conceive after 12 months of unprotected intercourse. And this is quite important because the chance of getting pregnant each month is actually quite low. It's something like 15% per month. So, if somebody can't get pregnant after 1 or 2 months, this may be normal, and we only really want to see patients after 12 months. So we know they've had enough natural chances to conceive. And then it's worth us doing various tests on both partners, the male and the female partner. So when you look at the causes of infertility, about 1/3 is purely related to the female partner, 1/3 purely related to the male partner, and 1/3 is a bit mixed, where you might get a slight reduction in the sperm function or egg function. So you can sometimes get a bit of a mixed bag in terms of things that are reducing fertility. And it's quite important because it may be something that's not making the person completely infertile, but just reducing the odds every month of conception. So they might eventually get pregnant, but their chances might be lower than normal. And sometimes when you do fertility treatment, you're just pushing up the chances to try and speed up the conception for the couple, so they don't have to wait for many years to get a baby. So let's go on to the male partner. And most people first ask me about lifestyle, should I be drinking or not, and smoking and all these things. And so I first wanted to look at, what are the actual figures, what do we know? And actually sperm is quite tough. It's actually quite hard to reduce its function. So if you have the odd drink every now and again, it's not going to really do too much to sperm.
Yeah.
But if you drink excessive amounts of alcohol, then it will reduce sperm function. And they've shown if you drink more than 4 units a day, 4 beers a day, 4 glasses of wine, something like that, that will definitely start reducing your sperm function. So if you're trying to have a baby and you're battling, you should be careful about how much alcohol that you're taking in. The same with smoking. People are not sure the exact dose, but smoking also reduces sperm function. Narcotics like cannabis, marijuana, and opiates can reduce sperm. Injectable testosterone, or even these days, sometimes people use testosterone cream as well. This will definitely reduce sperm function because testosterone feeds back to the pituitary gland in your brain and switches off the hormone that generates sperm, which is FSH. So if you're taking any kind of testosterone, it's going to switch off your sperm production completely. And I see many people that are doing various types of gym training, or otherwise a doctor has just prescribed testosterone for them because their sex drive decreased or their blood test of testosterone was a bit low. But as soon as they take that, their sperm function will go down to 0, actually. They will have no sperm. And it takes quite a while to recover. Because when you produce sperm, it takes about 3 months from it being produced in the testis to being ejaculated. So if you switch off the sperm, it's going to take another 3 months for it to eventually be produced again in the semen sample. So one has to be careful about that. People always ask about tight underwear. What's that got to do with fertility? And basically, sperm is produced optimally in a temperature that's a bit lower than body temperature. So body temperature is 37 degrees, and sperm is produced best at about 34, 35 degrees. So basically, that's the reason why the testes are hanging in the scrotum away from the body, so they can produce sperm at a slightly lower temperature than your core body temperature. Okay. If you wear tight underwear and push the testes close to the body, can heat it up and reduce a little bit the sperm production. People ask about having a laptop on your lap and getting warm and all that stuff, but that's not really proven to make much difference because it's such a short time frame.
Yeah.
Okay. The other thing is, what's quite interesting is in the environment, they've showed that sperm counts are decreasing globally. So all around the world, there's been a reduction in the last 15, 20 years in sperm counts. And people are not sure why this is. And there's been a lot of different candidates that might be causing this problem, things in our environment, which are not healthy for us. And some of the things are pesticides. So obviously our food is sprayed by the farmers, and they use something called organophosphates. And this can definitely affect sperm function. So it might be pesticides that we're eating in our diet. Occupational toxins like lead and cadmium and mercury. Some jobs have these type of heavy metals, and it can also affect the person's sperm function. And then the other environmental toxins, something called fluorinated substances, which come in plastics and things like that. And these things are also very bad for sperm function. Estrogen is normally in a compound used in a contraceptive pill, but they've actually found that there's quite high levels of estrogen in river water, especially in developed countries. So a lot of the contraceptive pills get recycled in the water and so on, and you start getting estrogen in the river water and that. And some places, this can start affecting, male infertility if there ends up being estrogen in the water supply. And there's also anti-testosterone compounds that they're finding in the river water. Interesting, some of the fish actually change their sex from male to female the other way around, or they get intersex fish from these changes in the hormone production in the water. And one of the compounds in plastics is called BPA, and there's quite a lot of work on that called bisphenol A and phthalates, which definitely affects sperm function. So these things are interesting. We use these things every day and we don't think too much about it, but it could actually perhaps be causing problems with sperm function. There can be other problems as well with a couple not being able to conceive, and that just might be that they can't have sex normally. So there's some kind of sexual dysfunction. And then ones that people know about is erectile dysfunction, where the person can't get an erection, premature ejaculation, or failure to have an ejaculation, anorgasmia. So these things can sometimes be relevant, and they need to be investigated properly by a urologist, firstly, to see that there's no physical problem, and sometimes a sexologist as well. So we need, as a fertility doctor, we have to know that there's no obvious problem in the normal sexual function of the man. There are some genetic things actually that can cause quite severe problems with sperm, and I've listed some of them here. Klinefelter's, where there's an extra chromosome, Cartagena syndrome. There's one condition where the vas deferens, that's a pipe that goes from the testicle to the penis to bring the sperm through, that can be absent in some men. So their testis is normal, but there's no pipe for the sperm to go through so that it can be ejaculated. And this is interesting. It's related to cystic fibrosis gene as well. So when we find this abnormality in the men, if we test them for cystic fibrosis, a lot of them have got an abnormal cystic fibrosis gene, which is a medical condition. And the last one, just to talk about, is called a microdeletion. What this means is a small piece of your DNA is deleted off your Y chromosome. The Y chromosome codes for sperm. And in some men, there's a little piece of DNA missing, and that causes a real severe problem in their sperm count. And this is interesting because we can use fancy fertility treatment called ICSI, where we inject a single sperm into the egg to make the couple have a child. But if they have a child, that child, if he's a boy, he's going to carry the same problem with his Y chromosome, because that DNA will be carried from the father to the child. So in some men, when they've got a problem, you can help the couple have a baby, and that baby will be normal, but it will also have a problem with its sperm count as well. So it'll also have a problem later to conceive.
Oh.
And then there's other problems like infections. Mumps sometimes causes infection of the testicle. So normally when you get mumps, it's in your salivary glands here and it's painful, but some little boys get it in their testes. They normally remember because their testis is quite painful. So people can normally remember when they get the mumps or chitis, but that's actually quite bad for the testis. It can damage the little cells that produce sperm. Some people's testicle can twist around. It's called a torsion of a testis. And it sometimes takes too long to get to the hospital. So when they get there, the urologist will untwist it, but by then it's damaged the testicle and it can't produce sperm. And then the last one is a varicocele. These are like heated vein or dilated veins around the testis. So in the scrotum, you can get veins that are dilated, and you get extra heat flowing past the testis because of these big veins. And this will reduce sperm production as well. And the other thing really coming sort of from genetic angle is that sometimes people have testicular failure from birth. So they're born without sperm because of their genetic problem. And often their testis doesn't descend. So normally when a little baby's born, what the pediatricians do is they feel in the scrotum to see if they can feel the testis. And in some of these people with abnormal function, their testis won't descend. And they all have a problem often of infertility. And also if you don't bring the testis down, they can develop testicular cancer as well. So what do we do? Okay, so these are some of the causes I've mentioned, but how do we actually investigate the male partner? So we would go through their history first, like I've, ask a few questions about to the couple to go through all those things and see if we can find any obvious reason just from talking to the patient that's carrying through in their family, in terms of a genetic cause. And then what we will do is do a semen analysis, which is basically getting a sperm sample. So the man will produce a sample. You can do it at the clinic or at home, and just bring the container, within an hour or so to the clinic. And then the laboratory will basically look at the sperm under a microscope, and they'll look at a few features, which I'll show you in a second. So that's a semen analysis. We sometimes do 2 samples, because sometimes you get one sample that's not so great, but you do another one and it can be normal. So it can be a little bit of variation there. We will do hormone testing on the man, which is the hormone levels I've mentioned there. We do this if the semen analysis is abnormal. So if the sperm is normal, it's not necessary to do this. But if the semen analysis shows a low sperm count, then we're going to start doing all these hormone tests and see what's going on. And we may also do genetic testing, where we start looking for these deletions in the Y chromosome and genetic problems. Okay, so this is basically what we look for in a semen analysis. So you can see there's quite a lot of things there: the volume, the pH, the count, total motility, and all these things. And basically the way they calculated this, the World Health Organization determined the semen analysis in 2010. So they took all the men that could have babies, the fertile population. They took that whole group, and then they looked at the bottom 5%, and they said that's where we cut off in terms of what we consider normal. So they looked at the men that could have children, and they said, okay, if you're in the bottom 5% of the population, then we can consider that abnormal. And that's where these values come from. They come from the bottom 5% of the normal male population. So if you look at the count per milliliter, so if you take a milliliter of sperm, which is not very much, there should be 15 million sperm in there. Okay, it's a lot of little tadpoles swimming around. Okay, and if you look at a microscope, you can see these tiny little things swimming around it. We count them with a special microscope, which has got like a grid line on it, and you can count all the sperm within a certain grid, and you multiply that sample to give you an idea, what the total count is. So the sperm count is very important. If you don't have enough sperm, then it's not going to be enough sperm to get all the way from the vagina during intercourse to the fallopian tube and find the egg. So the count is very important. The motility is important. The motility means movement. So we expect at least 40% of the sperm to be moving, and otherwise they're dead basically, and they're not moving, they're not going to work. And the last thing that we look at there is the morphology, or the shape of the sperm. So we look at how many perfect sperm there are out of 100. And if we get more than 4 out of 100 perfectly shaped sperm, then we consider it normal. So the semen analysis is a thing that's been around for a long time. They've just changed the values to try and get it more, a better understanding of what's normal and what's abnormal. But one of the new exciting things is the human eye can only look at sperm, in a certain way. So we tend to say around about 20% are moving around or something like that. It's like an eyeball figure. But these days, what we have is something called computer-assisted semen analysis, or CASA. So what that is basically is actually a computer that looks at the sperm, and the computer can identify all those million sperm and watch each sperm moving with, and it traces the movement of every single sperm. And then we start working out not just where the sperm is moving, but whether it's moving in the correct direction and how far is it moving? Is it just twitching, or is it moving forward? Or is it going around in circles? And we get a value called progressive motility, where we start understanding whether the sperm is more functional or not. So these are some of the things that a laboratory will comment on if you go for a semen analysis. And then there's a new thing also that's come out, because the semen analysis gives some basic idea, but it doesn't tell us about the actual DNA in the sperm. And what we're interested in, there's a thing called oxidative stress, which is in our environment that can damage the DNA in the sperm. So you might see the sperm and it might even be moving and everything, but maybe it's not great. The DNA is abnormal in the sperm. And oxidative stress can be caused by all these things I've listed here: smoking, drugs, pollutants, the varicocele heating it, advanced age. So men over 50 have increased incidence of DNA fragmentation.
Sorry, I'm actually hearing that word quite a lot now. Almost with every talk, people are talking about oxidative stress, and it's definitely not something we used to hear. So you're just hearing it so often now.
Yeah. Oxidative stress is basically little things called free oxygen radicals that are present from these type of things like smoking, will generate free oxygen radicals, and it's quite bad for the body, and it can still cause damage to all various different types of tissue. But sperm is also sensitive to it and can denature the DNA in the sperm. So there's quite a lot of things there which can damage, and including not taking the right vitamins and things like that, which we sometimes need for DNA correction. So DNA fragmentation is an important thing, and it's an extra step that we can do now. Instead of just a normal semen analysis, we can do a DNA fragmentation and get a feel for whether the DNA fragmentation is normal or not. It's not an absolute thing. So if the DNA is fragmented, it doesn't mean it won't work at all, but it's just another piece of information and might help us to decide what the cause is in the couple of them struggling to get pregnant. So, what you can do in terms of treatment now, let's move on a little bit to that perhaps. So let's say, for example, you've done your semen analysis and you find that there's a problem. The sperm count is a bit low or the motility is low. What can you do? So the first thing you'll do is lifestyle modification. So you have to ask yourself all those questions. Have I been taking too much alcohol, smoking? Am I living unhealthily, not eating well, not exercising? Am I overweight? Things like that. And if you are those things, then you need to adjust your lifestyle, and that can sometimes help to improve the semen analysis and may in fact be all that's needed, and then the couple can get pregnant. It doesn't always work if you get a really serious problem with the sperm though. If the sperm counts are very, very low, doesn't always help to fix it, but if there's a minor change, then it could be useful. If the sperm count is also a little bit reduced, you might do something called intrauterine insemination, or IUI. And there what we do is, with the woman, we give her medication to stimulate an egg to grow, like tablets. And she will come for an ultrasound. And then we will, sorry for that, we will give her medication to stimulate eggs to grow. And then we will basically trigger her with an injection to make the egg pop, and then we will insert the sperm basically into the uterus. So instead of having normal intercourse, we put the sperm right high up inside into the uterus, and this can improve the chance of the sperm getting to the fallopian tube in adequate numbers, and help the patient to conceive. So a simple treatment is intrauterine insemination. It's not very expensive, and it's an easy thing for couples to do. And it's very often the first treatment you'll do at a fertility unit is intrauterine insemination. And you might do that for a few cycles first and see if it's successful before going on to IVF treatment. You can, if the person's got a varicocele, that dilated veins around the testis, and they've got a low sperm count, then you may operate and fix the varicocele. The urologist might repair that and see if it improves the semen analysis. But it doesn't always work. That's a problem. Sometimes you fix it and it doesn't make a difference. And it would also depend on the other factors. Like if you need to do fertility treatment on the women's side, then you may not bother with the varicocele anyway, because you're going to proceed with fertility treatment. So if you look at what the American Urology Association say about varicoceles, or these dilated veins, they say it occur in about 15% of normal males, but about 40% of the infertile population. So it's more common in people who are struggling. But they only repair certain ones if they're big and you can feel them, called a palpable varicocele, and if there's no other indication to do IVF on the woman. Okay, and then what do we do if there's really a serious problem with the sperm? Now there's hardly any sperm, in the sample. Then we do the IVF treatment, which basically means that you're fertilizing the eggs and the sperm in a laboratory. So you extract the eggs from the woman, and then you fertilize them in the laboratory. And the procedure we do there is called ICSI, which stands for intracytoplasmic sperm injection. And what it's basically meaning is you can choose an individual sperm, so you don't need many sperm. The person can have a very low sperm count, and you can just choose an individual sperm that's moving, and you inject it with a glass needle into a little egg in the laboratory. That will fertilize the egg and make the embryo grow, and then you can put the embryos into the patient and she can have a baby. So you can
need one.
Just need one good one, yeah. So, it works in people who've got real severe male infertility. It was developed in 1991 in Brussels, where a student accidentally injected an egg into the cytoplasm of an egg. So what they thought initially was they would just put the sperm under the shell and it might help, but the student messed up and injected it right into the middle of the egg by accident. So they sort of shouted at the student and said they didn't know what they're doing and all the rest of it. And the next day, that student's eggs grew beautifully. And they
Ah.
realized actually that that's the way to do it. So they started injecting the sperm into the center of the egg cytoplasm, and this technique was developed. So it was figured out by accident, but it's become one of the main treatments that we do in fertility treatment. And it's revolutionized male infertility now. We can get so many patients pregnant who've got severe male infertility that would have never had a baby before, even with regular IVF. So there's a picture basically just to show you an illustration where a little glass needle is injected into the center of the egg, and the sperm is put into the egg. And there's like a little holding pipette on the side that uses a vacuum to hold the egg steady while the sperm is injected in. So people ask, how successful is IVF? And actually the success rate of IVF depends on the age of the woman, really, because the egg quality determines the success rate. So if you take a woman who's under 35 and you put her fresh embryos and any frozen ones that were made during that same treatment, so from one egg retrieval, putting the fresh and the frozen embryos, you should get a success rate of about 68% just from one egg retrieval. If the woman gets older, it's going to drop. And you can see over 40, the numbers start getting low, 22% at 41, and over 42 is like 7%. So the age of the woman is more the deciding factor in terms of IVF success. Now, some men have got no sperm, okay, and then that in the medical terms is called azospermia. So it means that in the ejaculate, there's not even one or two that you can find. There's nothing. There's just fluid in there, and there's no sperm at all. And with these men, we would first do some hormone testing to get an idea if the testis is functional. But if it is, then we do a testicular biopsy, which is like a little operation on the testicle to extract testicular tissue and look in that testicular tissue if we can actually find sperm. Obviously, if we couldn't find any, then we'd be stuck with the patient having to use donor sperm, okay, if they couldn't find any. So this is a picture of a testicular biopsy. You can see a little operation where the testis is opened and the tissue is extracted, and from there we actually get the little sperm cells out and injected into the egg. And it's done under anesthetic, by the way, for those men that are feeling nervous. So they don't. We do it when they're sleeping, and it's not so bad, yeah. The next question is, can you use medication to fix the sperm problem? So, and there are medications that have been useful in terms of developing sperm in men who've got very few sperm, but it depends a bit sometimes on their hormone profile. So if you measure their testosterone and it's a bit lower than normal, these drugs basically work by stimulating the pituitary, and that stimulates the testis to make more testosterone, and that can sometimes aid sperm production. So if you do hormone levels and the testosterone is a little bit borderline or low, the man might benefit from a medication called clomiphene citrate or Clomid or letrozole. And this is a very simple tablet that the person can drink, and it can help. But it takes quite a while to work because sperm takes about 3 months to be produced. And the optimal results with Clomid, that sometimes takes 6 to 12 months. So it takes quite long. And you might have to treat 10 patients to get one pregnant. So it's not that easy. The evidence for it is controversial, but the main problem, I think, is patients don't want to wait so long. So many patients, the woman's getting older, she doesn't have so much time, and we don't really have time to put the person on clomiphene for a whole year and see if it makes a difference. So those patients would rather just get on with the treatment that can work with whatever sperm is available at that time. And then just to end off, with donor sperm insemination, if a man has no sperm, but he can still be a legal parent, a legal father, by using donor sperm insemination. And in South Africa, sperm donors are screened as per the National Health Act, and we would screen the donor, collect the sperm and freeze it, so it's frozen. And then after 3 months of testing to check the person's out of the HIV window period, and we test them for a whole lot of other viral and bacterial conditions as well. They have psychological assessment and medical assessment to make sure that they're suitable. So once they've been through that whole process, then we can basically make that sperm available to a couple, but it's anonymous in South Africa, so they don't know the person's name, and it's anonymous sperm donation. There is also known sperm donation, but where somebody knows a sperm donor, that can also be done. but it involves a little bit more legal contract work. So an attorney has to draw contracts between the couple and the sperm donor to make sure that everyone's in agreement before starting. And currently the law in South Africa allows a sperm donor to have 6 live births. There's a current draft law in place that's recommending increasing that as well. So if people have had 1 baby from a sperm donor, they may be allowed a sibling birth as well. And that's currently in progress, yeah. And one last thing, maybe just for interest, people ask about COVID. Does it affect sperm? COVID can actually bind to sperm because there are ACE receptors on the sperm cells. So the COVID virus can actually bind on sperm, and it can decrease sperm function. There's no evidence it affects pregnancies at the moment. But in some men who've actually died of COVID, when they do the autopsy, when they look at the testis, it's inflamed. There's an inflammatory reaction from COVID. So it does seem to affect actually the testis and sperm function, yeah. So I just wanted to share some slides so you guys can get a bit of information, but and I hope it's useful. And, if there's any other questions, and I'm happy to answer them now or later on via email.
Yeah, I've just got one question, doctor. One question we always get is, what would you recommend someone does especially if they're going for IVF and, the few months before the time, what type of vitamins, multivitamin or something, would you recommend any male take to increase, increase his sperm count?
Okay, so there's lots of pharmaceutical companies that will say that this vitamin is great for sperm or this is good for sperm or whatever. But what they're talking about really is just providing the basic vitamins that are necessary for sperm production. For example, zinc and various types of amino acids and stuff that they put within the vitamin. So those things are probably good for sperm function, but there's no evidence published that shows that if you take any particular multivitamin, it's going to increase the pregnancy rate. So people look more at vitamins, and then they look at the semen analysis and the function of the sperm and try and work out whether having those vitamins will be helpful for sperm production. But it doesn't translate into more pregnancy. So we can't really recommend any particular vitamin as being better than another in terms of getting more people pregnant, because there's no real study that shows that. So all the studies on looking at vitamins preparations are more looking at the semen analysis than actually getting a baby. So I would just suggest that a person takes a good multivitamin, and most of these multivitamins will contain all these things anyway. So I'm not too worried about which particular multivitamin they take, as long as they have a healthy diet and they can choose any multivitamin they like.
Okay, perfect. Thank you very much, Dr. Roux. It's been such a pleasure, and we've learned quite a bit. I am definitely going to, if you have any questions to those who are watching, please put it in the comment section. We can still email it to Dr. Roux, and you can contact him at Cape Fertility Clinic. He is there. His details is on our website, and I will be posting more about it. Dr. Roux, you want to say something?
No, I'd just like to say thanks for listening, and we are here to help. So please come and see us if you battling to have a baby, and we'll do our best to help. And thanks again, Leanne, for inviting me to your talk. Thank you.
It's an absolute pleasure. Have a great weekend, doctor, and thanks everybody. Have a great weekend. Bye.